everyone from Midlife Fabulous. I'm here today with the fabulous Mr. Dr Nassif, Paul Nassif, plastic surgeon to the stars of Beverly Hills. And you probably also know him from the TV show Botched, one of my favourite shows.
Really?
Plastic surgery.
You better.
I do, of course.
And you've been using my products for a long time.
I have. I'm one of Dr Nassif's models, and today just want to talk about skincare and the sort of problems that women face in their 50s, in their fabulous 50s.
So, in the 50s. So midlife
50s.
Is in the 50s.
Midlife, yeah.
Well, I'm actually now 56.
So am I.
So are guys, that's what we talked about
Me
this.
too.
Are guys also supposed to have midlife and fabulous too?
Yeah, but we don't have crises. This is the whole thing, right?
I got it.
Okay.
I got
yeah.
it.
So
Okay.
you're doing well in your midlife, right?
I like it. I'm having fun.
Yeah.
Working hard though.
Working hard. Yeah.
Yes.
So what kind of things do we face? Do you think it's like, you know, the fine lines and wrinkles, crepiness under the eyes, that kind of thing?
Well, I mean, what happens to everybody, especially from the 40s, not just 50s, I know, the two things that I always talk about, number one is hydration. But as we get older, the best thing you have to do to yourself, whether it's a mask or some of my products, is exfoliation, number one. You want to remove all those dead skin cells and the junk from being outside. Exfoliation is so important to you. And then shrinking down the pores. And then, of course, using something that has something to hydrate and also active ingredients that help decrease fine lines and wrinkles.
Which is what we want.
Which is what we do.
Yeah, and we want to keep ourselves out of your surgery.
That's right.
If you can.
And remember, the more you do this, and starting even early, but since you're in your 50s, it's never too late to start.
That's right.
You have to do it now. And by the way, also good SPF. We don't have any SPFs now, but that's also very important.
Yeah, especially living in Australia. And Australian women out there, we know, we used to all go to, you know, what we're like when we're in our 20s, what were we doing on the beach?
That's right.
Baby oil,
Putting like
that kind
baby
of thing.
oil.
Yeah.
But remember, the ozone layer out here, I just had lunch with some folks from New Zealand.
Yeah.
And they were saying about going, you know, to the United States, being out in the sun versus here, you get burned. I mean, when I was here on that Bondi Beach, got burned very fast. So it's very important for you to actually have products that are going to work and hydrate your skin.
Yeah. Can I talk to you about one of my favourite products of yours? And it's actually one of my favourites, and Tina and I are going to have a little day where we're going to actually do the mask. So can you let me know what kind of benefits I'm going to get from it?
Sure. And by the way, this is thick. It's syrupy, but there's no alcohol in the product. So it's, and like the name of the product, it's a quick fix, face and neck, and you can also use it on your hands. And now it's going to take away all the crepiness. And by the way, you know, I was looking at some of the reviews. Someone said, well, it's too sticky. Well, it is supposed to be sticky. It's a mask. It dries into a mask, an exfoliating mask. And by the way, you can always put this in, you know, warm water if you have to loosen it up a little bit. And so the immediate benefits, first of all, it has all the fruit acids, like colic and the salicylic and the all the great fruit acids, which is, you know, and the alpha hydroxy acids, retinol. It has milk thistle. It has, you know, I can't even name about probably 15 different active ingredients to actually help decrease inflammation of your skin, help lift, tighten, fill, smooth. All those happen, especially if you go into an event.
Sure. Yeah,
So the great thing about this has long and short-term benefits. You put it on about 30 minutes. Then you're going to peel it off, okay? After you peel it off, and you can see some of the results on the TVSM website.
Yes, and I've used it
you have
before,
some.
and it's actually Tina that I want to let her have a go
Right, so that'll be
with the
fun,
mask.
Tina.
So that's what we're going to be doing.
And you start it down in your neck, your décolleté if you want, face, peel it off after about 30 minutes. And you're going to see the difference, especially if you take a photo of yourself before, straight and a little three-quarter view, jawline, neck wrinkles, face wrinkles, eyebrow, crow's feet, hollowness here. Get it all the way around your face, but not in your eye. So you have the short-term benefits, as I mentioned, to the exfoliation from the physical, removing the mask, and the last thing, long-term benefits from the retinol and the fruit acids. And so all these things are going to help you look better, look refreshed, look younger. Use this a few times a week. Probably, what would you say you use it? 12 or 13, or how many would you say you get in
I
one
use
of
it
these.
once a month, actually. For me, it's once a month, but it's up to you. You can use it as often as you like. So if you're
Especially
using
if
it
you're
once a
going out.
month, it's going to last you 12 months.
So yeah, but you're going out.
Oh, if I'm going out, well, it depends how often
Yeah.
I'm going out.
I mean, if you're going out,
I could run out
use
in
this.
6, yeah.
and then you put
exactly.
makeup on top.
That's right. And the
right?
makeup goes on beautifully.
So you're lifting, you're getting the instant kind of.
Yeah,
I'm gonna say it because we're not on TVS, and I can say
yeah,
you're kind of testing out what a mini facelift looks like
that's
by
right.
doing this.
Because
And you can also use this.
how
on
much
your
is a
hands.
mini facelift in your surgery?
With me,
Yeah, with you.
with operating room and anesthesia, US dollars, probably about 40,000.
Wow. Okay, there you go. So, girls, this is a great alternative. Dr. Nassif, thank you very much for
Thank
being
you
with
very
us.
much. Ooh, I got the
Oh,
stuff
yeah,
on here.
sticky. All
See, I
right.
got the sticky stuff on here.
Bye-bye. Thank
Bye.
you.